Good evening. What's on my mind? I'm Dr. Dale Dangleben, and on behalf of Patient Choice in Chemin, Neuf, Pointe, Michel, this is your medical tidbit of the day. I know it's in the evening, but when I work nights for the week, the evenings are my mornings. Get it? The evenings are my morning. So what I want to talk about today is multiple myeloma. All right. I think it's important to understand that and what it is, and it can be very devastating. And multiple myeloma is a cancer of your plasma cell. Now, your plasma cell is a type of white blood cell that is generated in your bone marrow. Okay, and they're the cells that produces antibodies that help fight infection. Okay, so in multiple myeloma, these plasma cells become abnormal. Okay, and they produce a large amount of an abnormal antibody, right? Which is called the M protein. Okay, and I know people might say, well, I got to break this down, but I'm giving it to you as is so you can absorb it and understand it. Okay, and the buildup of that protein, that special protein, harms the body. So what it does, it crowds the normal blood cells and it damages your bones, it injures your organs, especially your kidneys. All right. So the classic features, the way you remember it, is CRAB, CRAB. C is calcium, so you have high calcium levels. And with that, you get nauseated, you get constipated, confusion, fatigue. R is for renal, meaning kidney, and you go into kidney failure. Because what happens is this M protein, or something called Benz-Jones proteins, clogs the kidneys, right? So the kidneys cannot flush normally. A is anemia, right? And with anemia, you get fatigue, you get weakness, you get shortness of breath. And B is bone disease and bone pain. Okay, that's one of the things with multiple myeloma. You get rib pain, spine pain, your hip hurts, right? You get fractures, right? And if you get x-rays, you have what's called a lytic lesion, like the bone is missing pieces, right? So that in of itself is how the features, it's called CRAB. I just broke it down for you, right? Other findings is because your normal antibodies don't work, you get recurrent infections, right? You get this neuropathic pain, or you also get compression of your spinal cord, and with that spinal cord compression comes a lot of back pain, okay? And general weakness, night sweats, all this goes with multiple myeloma. There is a genetic component to this that I'm not going to get into, and it's predominantly in male, all right, over female, all right, and just something to know. It has a disproportionate burden in Black people. It's higher incidence, all right? So Blacks are twice as likely to develop multiple myeloma compared to whites, all right? So that is something to know. And in Black people, the onset is usually earlier, okay? 5 to 10 years earlier than any other race, all right? So we got to understand these things, right? And you when you add poor access to care, all these things contribute to worsened outcomes with Black patients with multiple myeloma. All right, so just understand what I'm trying to say here, because again, we have to break down these barriers to care. We have to educate ourselves. We have to educate doctors and to educate patients. Take the time, be patient, explain to the patients what's going on. What's Benz-Jones proteins, what's M protein, why does it affect your kidneys? All these things are important to know. All right. There's a slew of blood tests that can be done, and I will leave that for you to read up on. The urine test is the Benz-Jones proteins that I talked about. You could do a bone marrow biopsy, right? Looking at the plasma cells to see whether or not you have multiple myeloma, and also just images of your skeleton, right? Whether it's an MRI looking for bone lesions or even a PET scan, all right? There's a whole slew of therapy out there, and it's getting better, all right? There's stem cell transplant. There's heavy dose steroids, all right? So again, the immune focused medications, all right? There's newer therapies like monoclonal antibodies, a lot of other things in the pipeline, okay? And even the bisphosphonates for bone protection is important. So talk to your doctor if you're having any of these symptoms, see if you need to be worked up. Doctors, if you make the diagnosis, explain to the patient the next steps in terms of what they need. Some of these patients end up on dialysis, okay, because of the kidney failure. So these are the kind of things that we need to educate ourselves on to improve the overall outcomes for things like multiple myeloma. All right. So I just wanted to just touch base on that and let you guys know I did not keep you guys hanging today. All right. Enjoy the evening. I'm Dr. Dale Dangleben. Peace.